Hi, my name is Vanessa Cornelius, and I'm going to be discussing E-11 of the BACB task list. And so, to read it verbatim, from the 6th edition, it is identify and comply with the requirements for collecting, using, protecting, and disclosing confidential information. And so, for my key findings, they are broken down into 3 different ones. So, understanding personal biases, impact on professional activities, and then strategies for mitigating the biases that analysts sometimes have. So, for understanding personal biases, they can include assumptions, stereotypes, preferences that are unconsciously influencing decision making overall for your clients. From what I was reading, they can stem from cultural backgrounds, personal values, and past experiences, again, which will influence the way a behavior analyst will be providing clients treatment plans and how they even perceive the client's behaviors. So, for instance, a bias might inadvertently shape interpretations of behavior, especially in culturally diverse settings, which will impact the effectiveness of set interventions. And then moving on to the impact on professional activities. So, unchecked biases can interfere with objectivity, causing professionals to interpret client behavior inaccurately or prioritize interventions that may not be optimal for that client's specific unique needs, especially at the time, because then at that point the behavior analyst is focused on things because of their own biases rather than what they know like their client actually would need. So an example of this would be having a bias towards certain behavior modification strategies, and that might lead to a practitioner selecting methods without fully considering alternative approaches that might be more beneficial to the client. And the best example I have for this is when a behavior analyst goes straight to punishment procedures and do not exhaust all other interventions or procedures that have been proven to work. And so just having that understanding what's going to be most beneficial for the client and their unique needs. And then lastly, the strategies for mitigating biases. Behavior analysts are encouraged to engage in regular self-reflection, seeking supervision, and then utilizing feedback from peers, especially those who have possibly been in the field longer, or even just being able to speak out loud with another individual about a case, especially if you are concerned about personal biases. I think having that back and forth conversation with a peer would be extremely beneficial. And so some other strategies can involve actively questioning assumptions, seeking multicultural competence, and then again consulting with your colleagues to verify that the treatment decisions align with the client's values and needs rather than any predispositions that the behavior analyst may or may not have regarding that. Doing CEUs and the continuing education especially would be beneficial, so that way training on cultural competence and then just bias awareness would be great for professional development. The relevance of this task list item, while it emphasizes the extreme importance of self-awareness among behavior analysts, so we can recognize and mitigate biases that could affect our own work. So this will just overall aid in ensuring that clients receive impartial and effective services based upon their needs and their values and their cultural overall. So then just a little summary again, the main takeaways with E11 include understanding personal biases, understanding the impact on professional activities that could occur based upon those predispositions, and then knowing that there's strategies available to help mitigate these biases to be able to provide the most effective treatment overall for your clients. Thank you.